Okay, so you've seen the headlines, right? You've heard people talking about it. Superflu. It's a name that definitely grabs your attention, and this season, it feels like it's absolutely everywhere. So what are we really dealing with here? Let's unpack the hype and get to what's actually going on.
And look, this isn't just media clickbait. Health officials are really sounding the alarm. I mean, this quote from NHS England, it tells you everything you need to know. It paints a picture of just how intense things are on the front lines and how hard this is hitting our healthcare workers. The concern is very, very real.
Which brings us right to the big question. When you hear that term, superflu, what does it actually mean? Is this some kind of brand new, terrifying virus that we've never seen before? Well, here's the first thing you need to know. Superflu is not a scientific term. It's really just a nickname for a flu season that's hitting us particularly hard. The actual culprit this year is a specific strain of influenza A called H3N2. Now, we've seen H3N2 before, but this version has mutated. Think of it as a familiar foe that's learned some new tricks, and our immune systems just aren't as ready for it. So now we know what it is, but what does it actually feel like to get it? Let's walk through the day-by-day experience, because understanding the signs is your first and best line of defense.
First off, let's get one thing straight. This is not just a bad cold, not even close. The biggest difference is how fast it comes on. A cold kind of sneaks up on you over a few days. This flu hits you like a ton of bricks. We're talking about a sudden, high fever, aches that make your whole body hurt, and a level of exhaustion that just glues you to the couch. A cold is annoying, this is a whole body takedown.
And the seriousness of this season is really captured by the numbers. So far, the CDC estimates that this flu has been linked to 13,000 deaths in the US alone. Just let that number sink in. That's a staggering toll. This is absolutely not something to brush off. So what's a typical week look like if you catch it? Day 1, you're fine 1 minute, and the next, bam, chills, fever, aches. By day 3, you are at peak misery. That's usually the worst of it. Around day 5, you might start to feel a bit more human again. But that cough and that deep, deep fatigue, that can stick around for a week or sometimes even longer.
All right, now we're going to get into what is, frankly, the most fascinating and maybe the scariest part of this whole story. For some people, the biggest danger isn't the virus itself, it's their own body's reaction to the virus.
And this is the part that feels so counterintuitive. We all hear those tragic stories about young, athletic, perfectly healthy people ending up in the ICU. And you have to wonder, how is that possible? Shouldn't the strong immune system be a good thing? Well, in some cases, that strength can actually become a huge liability. The answer lies in a phenomenon called a cytokine storm. So cytokines are basically little alarm bells that your immune system uses to call for help. But in a cytokine storm, the system completely panics. It doesn't just send out a few alarms. It unleashes a massive flood of them, creating this out-of-control wave of inflammation that can start damaging your own healthy organs, especially your lungs.
And here's a simple breakdown of how that happens. Step 1, the virus enters your body, triggering a totally normal immune response. But then, in step 2, things go haywire. The immune cells go into overdrive, just dumping a torrent of those cytokine alarms into your system. This creates a dangerous feedback loop, the storm in step 3, which is what ends up attacking your own body. The irony is, a really robust immune system can sometimes fuel a much more powerful and dangerous storm.
Okay, so that's the problem. It's intense, but it is not hopeless. So now let's talk about our single best line of defense, the vaccine.
And I know exactly what you might be thinking. Okay, but if the virus is mutated, what's the point of the vaccine? It's a completely valid question, and the answer is actually really fascinating.
The answer is something called cross-protection. You see, the flu shot trains your immune system to recognize key parts of the flu virus family. It's like teaching a security guard to spot a specific type of uniform, not just one person's face. So when a new mutated cousin like H3N2 comes along, your body has a head start. It sees the family resemblance and can mount a much faster, stronger defense.
And you can see the vaccine's real power right here in the data. So its effectiveness at preventing you from getting any mild symptoms is pretty good. But look at that second bar. The vaccine is even more effective at its most important job, keeping you out of the hospital. Its real superpower isn't stopping every sniffle. It's stopping a mild illness from turning into a life-threatening one. And yet, we've got a huge gap in our defenses. This data for US children shows that more than half are unvaccinated this season. That leaves a massive number of vulnerable people unprotected, and since kids are such great little virus spreaders, it really affects the whole community.
So, knowing all of this, what can you actually do right now to protect yourself and your family? Let's get practical and run through the playbook.
Look, this is the foundational stuff, and it all works. Number 1, get your flu shot. It is not too late. And then, it's the classics. Wash your hands, cover your coughs, clean surfaces, and yeah, if you're in a really crowded indoor place, maybe think about wearing a mask. These simple things really do break the chain of transmission.
Now, if you do get sick, you still have options. Antiviral drugs like Tamiflu can be a real game changer. They aren't a cure, but they can make the flu less severe and help you get better faster. Here's the key though, you have to start them early. We're talking within 48 hours of your first symptoms. So if you think you have the flu, call your doctor right away. Don't wait.
Okay, everyone. This next part might be the single most important piece of information in this entire explainer. Most people will recover from the flu at home, but you absolutely have to know when it's time to get immediate medical help.
Please, burn this list into your brain. If you or someone you're caring for has difficulty breathing, chest pain, sudden confusion, or dizziness, these are not normal flu symptoms. They are giant red flags that things are getting serious and you need to get to an emergency room immediately. Don't second guess it. Just go.
So this season has really been a wake-up call. It's a powerful reminder that the flu is always here, always changing, and always ready to challenge us. And it leaves us with a really critical question to think about. Knowing what we've learned this year, how are we going to prepare for whatever comes next?